In this patient, there is excessive dump stagnation in the spleen, which flows to urinary bladder on the controlling cycle. The uterus is governed by urinary bladder, causing stagnation there, the fibroids. This stagnation can cause a heat reaction, yang rising to control yin, the occasional excessive bleeding. The clotty bleeding shows the stagnation of blood as well. Sa treatment for the spleen, we use spleen 8, the C-clef point, stomp 40, the Lu connecting point, UB20, the back shoe point. For the uterus, we use UB28, needle followed by cupping, back shoe, cupping removes stagnation, UB58, the Lu point, against the damp stagnation in the uterus. For the liver, we use GB37, the Lu point, circulates the stagnant blood. Spleen 6, the distal point for lower abdomen. Advise patient to avoid damp-producing food. Every young meridian, okay? Every young meridian has on its point, its grandmother point that will tonify its yin. Okay? Sa clinical example, we have the controlling cycle. We have a case of a female 39 years old. A female patient presented with fibroids and pressure discomfort on the bladder. She was rather plump with edema of the hands, feet, and face, which improved in the latter half of the day. Her menstrual cycle were between 40 and 60 days, and she tended to have a heavy bleeding with many clots. So, dito sa illustration, yung sa earth, yung spleen, mas mataas po yung yin, and nag-control ng urinary bladder na mataas din yung yin. Okay? For instance, if energy flows out of kidney, a yin organ, whether it flows into liver, which is the sun organ, or flows into the small intestine, the yang organ, it controls, it will always increase the yin in these organs. This is the deep energy circulation, which means the energy does not change its polarity. For this reason, the controlling cycle is an excellent way to tonify the opposite polarity of an organ. The yang organ, large intestine, receives yin from its coupled organ, the lung, and in controlling cycle from the heart and the pericardium, the yin organs in the fire element. So point Li5, the fire point of large intestine, tonify its yin. Each meridian has many connections with many other meridians. Some of these connections are on the superficial energy flow. Some are on the deep energy flow. When changes occur in the energy status of one meridian, it has a snowball effect on all the other meridians it is connected with. This is why clinically we notice that one illness, surgery, symptoms is the starting point of many problems. And this order of disease or appearance of symptoms cannot be explained by the conventional schools of medicine. In fact, it is thought that there is no connection between the symptoms. If you look at it from the TCM point of view, you will see that not only is there a connection, but also that these symptoms could have been predicted and, more importantly, prevented.